Hey everyone, welcome back to the Chinese Medicine Podcast. Today I'm going to show you how you can give your partner a massage to help with their neck pain and their back pain. I've got one of my students here who's volunteered to be a model today for me to show you how to do that. So what I'm going to do is talk you through some acupressure points that you can use and show you how to find them on someone where you don't know what you're doing, and I'll talk you through it. So what you can do is, while you're watching this video, you can do it on your partner, your friend. You might have, a dad, a mom, a brother, a sister, a dog, someone that's there to help you learn and would like to be your model. So you can practice along, and this is a way that you can kind of learn a little bit of acupressure and also learn something you can do when you're waiting to have a treatment yourself. You might be the middle of the night, you've got a headache or something like that. So I'm going to show you some acupressure points you can use to do that. Let's go. Okay, so the first thing you want to do is put your hands on the top of the shoulders here, and what you want to kind of do is feel that there's a bone here, right? And whenever you press on bone, that's usually very painful. So you don't want to press the bone like too hard, because that's when people give you a massage and they just squeeze. It's very uncomfortable and not very nice. So if you just kind of feel, if you put your hands on like you're going to pat someone on the back, that's a good way to start. And also you can just, whatever you do, if it's your partner, they've already consented because they've let you do that. But you should always ask people, is that okay to touch them, and not just go up to random strangers and sort of grab them on the shoulders. But if you kind of feel where their shoulders are like this very lightly, you're not going to do anything that's going to hurt them too much by just touching them lightly like that. And then we've kind of identified where the bone is. That's the spine of your scapula, and that's like a little triangle kind of bone there. So what we'll do is we'll just be above that area, and all this area here is all nice and soft. And if you don't know what you're doing, then you can just start by pressing. And pressing is like just using your thumb like this to kind of just push into the spots. So if you imagine the spine's kind of going down the middle, right? And then just either side of the spine, just press very lightly. Now I'm not really pressing very hard, and that's good because it's not going to hurt them, but it's also not really hard enough to do anything. So what we'll do is we'll start by pressing softly and just make sure that that's okay, and just tell the person that you're doing it with, if at any time it feels too hard, you can just let me know and we'll just stop or press softer. And you can just kind of press either side of the spine here, just very, very gently. The other thing to remember is, like often with acupressure we do it through the clothing, but this might be a bit too thick, this clothing. So you can just kind of pull that down a little bit, and then you just through the thin t-shirt, and just either side of the spine you can just kind of press up and down, and that's very, very lightly. What's that's going to press is your bladder channel in Chinese medicine. So what I'll do is I'll put up a little photo next to me that you can see those points, right? Now what you want to do is just go one side at a time now, and we're just going to use the thumb like this to kind of roll across the muscle a little bit. And this is a very gentle way of doing it. You don't want to press it too hard. But the muscles here are going to be going down this way, and when we're rolling across, it's actually a lot stronger in pressing it than sort of pushing like this. And also when someone's head's like this, when they don't have a place to kind of rest their head, you can actually push them, and it can be a bit uncomfortable. So if you're worried about doing that, the other option that you do, and then we do this in Chinese massage a lot, is sort of hold their head. So I'll do it like this on this side, or if you're working on this side, you can just put your hand on the front of their head. And don't push their head with your hand, just hold it there, just rest it there, so that when you're pressing, they're not feeling like they have to tighten all their body to withstand this weird pressing and pushing that you're doing on them. So we'll just kind of do this like lightly, either side of the neck, and start up here. And you can see his skin's getting a little bit red there, which is kind of good because that means we're getting more blood flow there. And it's not hurting, is it?
Nope.
Yep. So we're just kind of pressing either side of the spine. And if you feel bone, or you're not sure what bone is, go back to this area here and feel that. That's what bone kind of feels like. Don't press too hard on the bone. So if we're in the middle here and someone's got a bit of a bony spine, that's normal to feel that. You want to be in between the spaces where the bone is, not pushing right on the bone. And that's the secret of kind of finding the acupressure points. There's really like no acupressure points or acupuncture points are going to be in the bone. Like no one's going to be needling you into the bone. So if you feel the bone, just move away to the side of it. And another thing to remember that makes it really easy is most of these points have like little natural depressions. So if you press very lightly here, and my fingers will just kind of, they just sink into this little spot there. So you can just kind of find those spots, and you're not going to make them sort of worse by pressing the wrong spot. Just go across. So we'll go down the spine this way, either side of the spine, just in the neck, and then we're going to go across. Now, what's great is he's got a little t-shirt line there, which is just almost in line with the gallbladder channel, kind of coming around here. And so we'll just go down there. And you can use your thumbs to press in on that. So what I'll do is I'll just move a slight bit this way a bit, so we can kind of see here. Now what you can do is you can also use your elbow to press, to lean in on it. So I'm just going to use my body weight to sort of lean, and not use the point of my elbow because that will be very sore, too strong, but I'm going to lay my elbow across like that. Now the only people you wouldn't use this point on is people that are pregnant. So if you're pregnant, don't use this point here. Right? You can still do this neck massage here, and if you just touch around this point, that's no big deal, but you don't want to like push that point too hard. But if you are trying to bring on labour, let's say, or you want to like encourage milk to come down, like if you're a woman, you're waiting to feed your baby and the milk let down reflex is difficult to start off, that's a good point to kind of do that. But in this case, we're just using that point to help with neck pain, which might affect your gallbladder channel. So where does your gallbladder channel go? Well, it kind of starts around your eyes, it goes around your ears, circles around this side. So if people have problems with the side of their head, ear pain, earaches, a lot of neck pain sort of is in this little spot here, then you want to get into that gallbladder channel. So after this point here, it just kind of goes down, into the side of your body. So this is your opportunity to kind of use that, the last point on this torso area to get that gallbladder channel going. Right, just move you back a little bit. Again. Okay, so now we've done that, and that wasn't really very hard, but I would just recommend you do it softly as you start. Just bear with the pressure that the person can take. So now I'll do it again, a bit harder. Just either side of the spine, that way. Like purposely not making this too complicated. Like we could go through hundreds of like individual points here, but that would probably just mean that you might not do anything. So let's just make it easy. And then what we're going to do is, this is a technique in Tuina Chinese massage called grasping. What you're trying to do here isn't squeezing, like don't squeeze the two fingers together too much, but just sort of more with the palm rather than squeezing like this, otherwise that's going to hurt. And you can just get this bigger part of the muscle. So this is your trapezius sort of muscle, this little sort of part of it up here, and then there's other muscles underneath there. So as you're doing this, and because we're doing it nice and softly, you'll probably feel on your person there's something tight. Oh, there's this tight spot right here. It feels tighter than the other areas, and that's what they usually describe as a trigger point. So don't have to get too complicated about it. But if you feel one spot feels like, one of these things is not like the others, like that spot there feels tighter than the other kind of areas to me. So what I'll do is I'll just use my thumb. I'm just going to stand like this so I can put my body weight on there and just lean all my force through that thumb into that point. Now, why would I use my body weight? Because I don't want to hurt my wrist. If I just try to press with my thumb and I don't have my wrist straight, it's kind of, the force coming from my arm. After a while, I'll probably get a sore hand. So what I'll do is I'll just use my body weight. You can't really sort of see that, but bend your knees, sort of push into it. So I'm just trying to do it so you can see. I'll do it with this hand so you can see what I'm doing there. And we're just going to push into that point. Now, if you've pressed that too hard, or the person's like, oh, that's a bit sore, then just stop what you're doing and you can just very lightly rub across. And these are all different techniques that we use in toner. So this is just, you know, brushing the surface of the area very lightly. All right. So when you have toner, Chinese massage from a massage centre, like most of the time the people that are working there have probably trained for several years to do those courses. So it's okay if you feel like, oh, I'm not sure what I'm doing by watching a 5 minute of a video. It takes time to kind of learn how to do this. And this is really what I'm showing you is more acupressure rather than proper toner Chinese massage. So what we're trying to do is press on the point, and then as we press on that point, it's normal for the feeling to kind of maybe go up the head, or sort of might go this way, or sometimes even go down here. So we've kind of just found what points you feel are sore to you, or you can ask your partner, like, where do you feel the most pain? Like, where's the tightness for you? And you can kind of work on those areas, right? One thing to remember with this as well is when you first start doing it, it can sometimes stir up a bit of pain there. So if you give someone a half massage, like they've got really tight neck and they haven't had any treatment for a while, and you start working on it, you can kind of feel a bit sore. And if you just sort of stop, then they might even feel like it's worse. So it's important to kind of do a softer massage for a longer time that they can tolerate, and don't just sort of think, oh, I've got 2 minutes and we'll just do that, because sometimes that might make it worse if that's all you do. So what you could do, if that's the case, you could use a hot pack. So you could put a hot pack on their back across there, and then you know, let that sort of do its job, and then you come and press the points and help to relax it with the acupressure. So I'll go through a couple of key points that you can find. That first one here is called gallbladder 21. You can Google that and find more about it if you want. So that's kind of halfway between the spine area here and this bony process that sticks out there, that's called your acromion process. So if you just sort of divide that in half, you come a bit further up into that little depression. That's gallbladder 21. So we can press it, we can use our elbow to lean onto it. You can do this, like a little pecking method. You would have seen me do this on other videos. That's gallbladder 21. The next one you want to use is gallbladder 20. So it's still on that gallbladder channel up here. Now, how we're going to find that is roughly where the hairline is. So just sort of, if they've got hair, you can just sort of lift that up. Then bring your fingers up into this hollow space until you feel where the bone is, and then come back down from the bone in here. So the angle of this point, like how you should imagine pressing it, is towards the other eye. So I'm kind of pushing in that angle. Now here's a little trick for yourself or your partner. If you're pressing that and they're like, oh, you can press me harder, and you know, I'd like you to do it more firmer, but you don't have the strength to do that, you can take their head and just push their head a little bit into where your finger is. So I'm not even hardly pressing on there, I'm just using my finger to kind of point where the point is, and we just lift the neck back a little bit. Don't force their neck, just do it very slowly, and you're not trying to do any manipulation or anything, you're just kind of holding the point and pushing their neck, or tilting their neck is probably a better word, just tilting their neck into that point. So that's the point most people love to be pressed on, gallbladder 20. And you can use 2 fingers at once like this, and just kind of a circular motion, which is like a kneading, doing it like that, and then coming down that area. So the 2 bellies of the muscle here that you're kind of touching, this is your trapezius muscle here, and this side of that gallbladder 20 is your sternocleidomastoid muscle, which goes all the way around your neck and this kind of area here. So if people have a stiff neck, they've woken up and this is sore here at the front or around the front of their jaw, then this is a good point to kind of use. So I just want to keep it very simple today, not give you too much to get too concerned about. But gallbladder 21, gallbladder 20, we've done the bladder channel just down that way. We've just done that pressing. So remember to start with just very light pressure, sort of just saying hello, touching the back, feeling where that spine is. Now, if we come back between where this spine of the scapula is here, and we go directly above the middle of that point. Now if you can't find the exact middle, that's okay. That's a point there, that's a small intestine point, and it doesn't really mean there's something wrong with your small intestine, but it's just the channel of that area. So this whole channel actually covers like this part here, all this part here, it goes down the side of your arm, onto the face and the head as well. But mostly this channel is really responsible for this part of behind your scapula, where a lot of people feel sore in here from using their computer or their phone, or like doing this, their arms, like their thumbs and all that. So what we'll do is we'll just go very gently around that bone. So above the spine of the scapula there's a point, and then below. Now the below one's not directly, but just in that soft part. Now I'll put a little picture here where my hand is, and you can kind of see the triangle of the scapula. And when I teach this to students, I usually just tell them like to spend a bit of time sort of tracing that out, and lots of students have trouble finding that, so don't worry if you have trouble finding it. As long as you're not pressing on the bone, it's not going to be uncomfortable. And because we're doing acupressure, you can't sort of do it wrong here. Like you can just press a different point. It's not like you're going to, if you're doing acupuncture, it's very important that you're in the right spot because of where the structures are, and puncturing people's lungs and all that sort of stuff. But when we're doing acupressure, we don't have to worry about that. So if you feel here where the bone is, that's the edge of the scapula or your shoulder blade, and we can kind of go from that way in here, and just around there where you can do that same technique you did up here to feel, is there a little trigger point there? Is there a little spot that feels more sore than the others? You can kind of press on that. Okay, another one you can do is just here at the side of the scapula behind it. So we can kind of use our thumb. Now this is a really good technique to do, going like this across, like strumming, sort of like if you were playing an instrument and you were strumming across a string, right? So you want to imagine the muscle here is like a string, and some people's muscle do feel a bit stringy. And you're just kind of pushing down and sort of flicking up a little bit. And that's a very strong technique that's easy to do. Like most people can easily do something like that. The other way to do it is just press. So we can just press, right? Press, 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 press down. Usually with Chinese massage there's a lot of rhythmical sort of movements, so you might see my hands doing this. I mean, we have these things, I'll show you just a little bit of what proper Chinese massage would use. These things like rolling, this kind of thing. We call this one sort of a one-finger digitation. No, you don't have to do all this, and these kind of things would take quite a bit of time to learn, but you can give your partner quite a good massage by just doing those softer techniques, right? And if they want it harder, or you're like, I'd like to be able to press them, more firmer than what I can do, use the technique of either using your body weight. So I'm going to hold his shoulder here and just push like that, and lean, like I'm leaning with my hips into that point. I've chosen this position because like you might be sitting in front of the TV doing something. They can sit down on the floor or on a cushion. You can be seated on the lounge and be doing this, or they can sit on a chair and I can sort of stand here next to them, or you could have them lying down. So if they're lying down, you can really push your body weight onto those spots. But if they're lying down, the other thing is their head's going to tilt because you don't have a face hole to put their head in. So that could be very uncomfortable if they've already got a stiff neck or they've got soreness. So this seated position is a really good one. Okay, now we've done all that, and let's say we've done that kind of on the other side there as well. And then what we're going to do at the end is we're either going to do this kind of squeezing to sort of stimulate more blood flow here. And then my favourite one at the end is this, what's called chopping. So what you do with chopping is you have a really loose wrist like this, right? So see how my hand is sort of very floppy, right? And the edge of the hands is going to be the one that hits them. Now, what's important about chopping and all the hitting methods is you don't do it on the bone. That would be very painful and horrible. So what I'm going to do is imagine here's the spine, and this is the scapula, right, which we've already messed about with here. We know where it is. So we're just going to do the chopping in and out of that area, not on here, just here. And then we're going to come up here, and I'm just automatically pressing softer because I don't want to hit that bone too hard. So don't go, oh yes, I'm going to karate chop them with all my strength. Just do it very lightly, like this. And if you're worried about pressing them too hard, you can change the chopping into what's called padding. So see how my hands are going like this, into cupped, like open cupped, not flat. That would be also painful. So like this, and then padding. So I'm just going to stop talking so you can hear the different sounds. So that's a different sound to this, right? Hear the acoustics of it. So you don't want that flat sound because that's going to hurt your hand for one, because there's nowhere for that pressure to kind of vibrate and resonate. So when we have a cupped hand, it's less painful for them, and I can kind of cup my hand like over the bone and it's still nice. So we'll try that again. Chopping either side of the spine, up and down, and then go into the padding. And I usually just do that at the end, so that's what I do. You can do what you want. And that's how you give your partner a little massage that can help with neck pain, back pain. If they've got pain in the shoulders, might be feeling like they're going to get a headache. So I hope this has been useful and helpful to you. And if it has, make sure you subscribe to the channel. We're trying to get to 10,000 subscribers this year, and we're about halfway there. So if you've liked this video and it's helped you, make sure you subscribe, and let me know in the comments if there's a video you would like me to make. You've got a question about Chinese medicine, that's what I do, I'll answer that. So thank you so much, and I hope to see you again on another video soon.